like to talk about rhinoplasty. So Dr. Adnan, please, could you explain what is rhinoplasty and what patients should expect from the treatment?
Okay, so thank you, Risha. So I'm Dr. Adnan. As you've already introduced, I work at 𝐦𝐨𝐫𝐞 in Dubai. I'm a consultant plastic surgeon. So what is a rhinoplasty? Rhinoplasty, or a nose job surgery, is an operation to correct any nasal imperfections or functional issues one might have with their nose. It is indeed one of the most challenging operations in aesthetic surgery, and performed well, it is extremely rewarding for both the individual and the surgeon alike, with really satisfactory outcomes. However, given the nature of this surgery, one of my mentors used to say it's a surgery of millimeters, and it still is. There is a whole process an individual has to go through to assess the suitability of this operation. Certainly it's not for everyone. So I start by taking a good history from a patient. If someone requests a rhinoplasty operation, pretty much I start by asking them, what are your 3 or 4 main concerns as to why you feel you need a rhinoplasty? And there are a wide range of answers that I have come across in my practice, from a big nose to a short nose to a hump to a correction or bad surgery done elsewhere, or breathing problems, functional problems, doctor, I don't like the look of my nose, or I want to look like XYZ influencer or an actor. All these responses you get in my practice on a day-to-day basis. My job as a surgeon is to see if the concerns of the individual match the deformity or issue they may have with the nose. And it is only when those two things are close that I will go ahead and consider them for rhinoplasty. So from a surgeon's point of view, I look at the face overall, not just the nose, if I'm assessing someone for a rhinoplasty. And I say this to my patients all the time. Face is not about symmetry, face is about proportions. In fact, no two sides of the face are the same. And I think that's, as a surgeon, from my point of view, the idea is not to achieve symmetry, but however, it is important to have a proportionate, balanced face. What do I mean by that? I mean different proportions in terms of forehead, mid-face, lower face have to match each other. For example, it's not uncommon for someone to have a dorsal hump and a retruded or a small chin, so it has to be evaluated together in that sense. So yeah, those are the commonest complaints I get, patients requesting a rhinoplasty, and once I've addressed their concerns and listened to them in terms of what their desired outcomes may be, I would examine them thoroughly. I do a whole nasophacial analysis. I look at the nose, I look at the proportions of the nose, whether the nose fits the face proportionately or not. Then I assess the breathing, I look inside the nose, and I look at the overall face as well. And let's say once after doing all of that, I use photographs a lot because it helps me in my planning. And in selected individuals, I do computer imaging as well, and I think that's extremely important for the clients to see or have a vision of what they may look like after surgery. It's all good for me knowing what I would like for my clients to look like or what the surgery may result in. However, if the patient has got no concept or vision of this, then we may end up having problems after surgery. So surgery itself, I do it in the general anesthetic in a hospital setting. Most patients of mine go home the same day. They do have some splints on the outside and inside of the nose to protect the work, and they last for anything from 7 to 9 days. In my practice, most of the stitches are removed in 7 to 10 days. I predominantly do an open septal rhinoplasty because I feel it gives me better, predictable, consistent results. In selected individuals, there is a role for closed rhinoplasty in my opinion, and I know different surgeons have their own preferences in this regard, and the jury's out on that one, but I personally feel I get better results with an open septal rhinoplasty. The price to pay from the patient's point of view is a small scar. if planned well, you don't actually see the scar after 3 to 6 months. It's usually an inverted V scar here or a little stair step in this region. So I know patients get put off by scars in a rhinoplasty, but I always show them my results before and afters, and I think that's very important for them to see surgeons' work. And I emphasize on the fact that scars, if planned well, do fade away over time. So it's not something that visible unless someone's really, really close to an individual and is looking with a magnifying glass. Generally, rhinoplasty itself is not a painful operation. However, a degree of discomfort is expected for a week, given the dressings and the splints that are on. And most people feel like they've had a cold or a flu. However, in the era of COVID, one has to be extremely cautious at doing rhinoplasties, and I certainly have a certain standard operating procedures in relation to rhinoplasties, which I follow now, for example, with COVID precautions. All my patients are tested for COVID to begin with, and the nasopharynx and the nose and the mouth area are prepared in a certain way to reduce the viral load while I operate. And that certainly has changed my practice in this regard in the operating theatre as well.
I know some doctors that use grafts and implants and the nose. Can you explain which patients can consider this and what do you think about this?
Very good question. So rhinoplasties broadly are either primary rhinoplasties or secondary or revision rhinoplasties. Tertiary rhinoplasties are also there. So primary rhinoplasties means that rhinoplasty has not been done before and it's the first time. Secondary and tertiary rhinoplasties are revision rhinoplasties. So I reserve the use of ribs or costal cartilage grafts, sometimes fresh frozen ribs as well, which are irradiated for the secondary and tertiary cases where the cartilage may have been removed to a degree where it cannot be used, or where the deformity is such that you may need to reconstruct the nose a little bit. So rhinoplasty is an umbrella name for many different operations, and it means different surgery to a different individual. Every individual is unique, and every rhinoplasty is unique to that individual. And I think that's very important concepts for my patients to understand. In terms of silicone implants, I am against implants in the nose. I don't like them. In my experience, they always had problems long term, and they've warped. You can tell if someone's had a dorsal implant. Certainly in my hands, I don't use silicone implants. In selected cases, yes, costal cartilage grafts have to be done in revision rhinoplasties. Usually these are complex surgeries which take a long, long time to do. So it's extremely important to get rhinoplasty done right the first time.
And what are the complications of the rhinoplasty? What is the downtime?
So I would say the splints, for example, come up after 7 to 8 days. Most people can return to their normal work, office-based work, during or after the second week. However, the swelling and shape of the nose changes over time. Major swelling goes away and bruising sometimes after 2 to 3 weeks. However, the final swelling can take up to 6 months, sometimes even up to a year before the nose settles down. So I always have to counsel patients for this. Major complications after rhinoplasty are extremely rare if planned well, such as pre-assessment of the patient. I get all my patients are seen by an anaesthetist preoperatively. They have a set of blood tests to make sure they're fit for this type of anesthesia, and any coexisting medical problems are controlled or addressed before we do the surgery. Issues with rhinoplasties, I think it's a very challenging operation because it's very difficult to sometimes match what might be in the person's head, what they might be expecting. So this is what I call fine-tuning in rhinoplasty. I think it's extremely important to sit with the patient, and I do a 2 consultation process with all my patients. The first consultation is more like an educational visit, and the second consultation is more like a planning visit. So I give patients time to think about it, more like the cool-off period, where they go home, read about the information I've given them, think about it, and have realistic expectations. I think that's extremely important. So once all those things are done correctly, then in my view, the chances of having issues after rhinoplasty are minimized. However, there are patients who are still unhappy, and that's life, and you sometimes have issues such as not so satisfactory shape that you may have wished for after rhinoplasty. Occasionally there can be infections and so on, and scarring and bleeding, which may change the shape of the nose long term. So there is a revision rate for every rhinoplasty, and I think as a surgeon I always aim to keep my revision rate low, and that comes with good planning during primary rhinoplasty. But those risks are there, and I think that's important for a patient to understand all those things.
That's true. I know you have a lot of cases of secondary rhinoplasty, and you fix a lot of mistakes done previously with other doctors. And how long patient needs to wait to go for another surgery?
Good question. So yes, unfortunately my practice in Dubai is certainly developing as a revision rhinoplasty surgeon. I would generally advise patients to wait for at least a year after their primary rhinoplasty to even consider secondary work. And I always encourage them to see their original surgeon first to see if problems can be addressed by their surgeon. And I strongly feel about that. I think most surgeons would also welcome that because at the end of the day, a surgeon knows best what they did with the original surgery. And I would always be second guessing. So that's my first thing I say to my patients. In the patients I do take on revision rhinoplasty, I always counsel them about having realistic expectations. I have lots of discussion with them about the issue that they may have and what could be achieved and what could not be achieved. So I think with revision rhinoplasty, it's very important to explain to patients what cannot be done and what can be achieved. I think those are two very different things, certainly true for revision work.
And the last question about fillers. A lot of patients, they go for fillers, they do filling with the fillers, and then goes like...
Good question.
Just give them examples.
Fillers to the nose, also called rhinomodulation. I do use fillers, and I think a lot of patients don't want to have rhinoplasty. They don't want to go through the surgery and the stress of it all. They cannot afford to have time off, for example, and they can't have downtime and so on. So in selected patients, I do use nasal fillers, and I think certainly patients who may have had multiple surgeries on their nose before and don't want any more surgeries, I think fillers have a role. Generally, fillers have to be done in a safe way, and I think they can address issues like dorsal harm. They can straighten the bridge of your nose, they can elevate the tip a little bit. Those tip refinements can be done by the use of fillers. However, in the wrong hands, everything is risky, right? So certainly fillers on the nose done by inexperienced people can be dangerous, as filler material can enter the blood vessels and cause issues such as inflammation, necrosis of the skin, and very rarely even blindness. So those things patients have to be aware of that. So always choose the right surgeon, make sure they're both certified, make sure they're experienced in the art of what they do. And I think that's the most important. However, overall, fillers done in the right hand is extremely safe. I tend to use them a lot, and I think patients who do not want surgery, it's certainly an option. It's a really good option.
Okay, thank you so much, Dr. Adnan. It was very informative. Thank you.